Charles Edmund Cullen was born on February 22, 1960, in West Orange, New Jersey. The youngest of 8 children, his early life was steeped in tragedy. His father died when Charles was just 7 years old. By age 9, he attempted suicide for the first time. These early signs of instability would foreshadow a darkness that would later engulf dozens of lives. In 1987, Cullen married Adrienne Bell. The marriage lasted 6 years, ending in divorce due to erratic and disturbing behavior. By then, Cullen had already begun his nursing career, a profession that gave him access to the most vulnerable. His first known murders began in 1988 at St. Barnabas Medical Center in Livingston, New Jersey. Cullen's method was silent and insidious. He injected lethal doses of digoxin and insulin into 4 bags. Patients died quietly, often without suspicion. Over the next 16 years, Cullen moved between hospitals in New Jersey and Pennsylvania. Each time, he left behind a trail of unexplained deaths. Despite growing suspicions, Cullen was never stopped. Hospitals feared lawsuits and reputational damage, so they let him go, and he kept killing. By the time he was arrested in December 2003, Cullen had confessed to murdering at least 40 patients. Experts believe the real number could be over 400. For 16 years, Charles Cullen moved through the healthcare system like a ghost, quiet, calculated, and deadly. 9 hospitals across New Jersey and Pennsylvania hired him, trusted him, and then quietly let him go when suspicions arose. Each time, no criminal charges, no warnings to future employers, just silence. At Warren Hospital, a grieving son raised alarms after his mother died unexpectedly. At Somerset Medical Center, a pharmacist flagged unusual medication orders. Nurses whispered concerns, but administrators hesitated. The fear of lawsuits, reputational damage, and public scandal outweighed the urgency to protect patients. It wasn't until the New Jersey Poison Control Center stepped in that the pattern was finally exposed. Cullen's quiet exits had become a trail of death. And on December 15, 2003, the nurse who had slipped through the cracks for over a decade was arrested. But the damage was irreversible. Families were shattered, lives were lost, and the institutions designed to heal had failed to protect. Cullen's case wasn't just about one man. It was about a system that chose silence over accountability. And that silence cost dozens, perhaps hundreds of lives.